So in today's video, we're going to be talking about back pain, in particular back pain that has started a little bit early on in our life, particularly if it started perhaps in our teenage years, our 20s, or our 30s. Now, back pain is a very common complaint, and it gets increasingly more common as we get a bit older. But if you've been experiencing that back pain for some time, especially if there's not been an obvious trigger, it's possible that the cause for that back pain is actually inflammation, and it's the immune system that's responsible for causing the symptoms. When we're dealing with inflammatory back pain, doctors call this axial spondyloarthritis. It probably doesn't come as a surprise that doctors have a long-winded way of describing this. While we do like to have technical language, the reason is that it actually explains what's going on. So in this case, axial refers to the axial skeleton, that is the spine and the rib cage. Spond is another way of saying spine, and itis is inflammation. There are several different types of conditions that fit under axial spondyloarthritis. The main and key one is ankylosing spondylitis. This is a condition where you get spinal inflammation, spondylitis, that can go on to cause fusion of the bones where there's inflammation, which we call ankylosis. Sometimes we call this Sero-negative axial spondyloarthritis. We've covered what axial spondyloarthritis is. Sero-negative means it's not found with any particular antibody, or at least we don't know the antibody that is found. So these are different ways that we call it, but for the video, let's just call it inflammatory back pain. So why or how would we work out that the pain that we're suffering is inflammatory? Age is one factor. If you've had new back pain come on in your 60s or 70s, the chance that that is new inflammation dramatically reduces. If you have a new back pain come on in your 30s, that doesn't mean you've got inflammatory back pain, but it certainly does increase the risk. In particular, if that pain doesn't seem to have come on as a result of something, the question is, where has it come from? So often patients with inflammatory back pain have an insidious onset. If I ask them how long's it gone on for, I don't know, a few months. What triggered it? No idea. The pain also has some characteristic timings and it has a pattern. So it's often challenging for patients with inflammatory back pain to get out of bed in the morning because they're really stiff. It really takes them a while to get moving. Usually with inflammatory back pain, you find that movement tends to help. So often, if you had a commitment in the morning, you might have to set the alarm an hour or two earlier just so you can get stretching, just so you can get moving in the morning, or get yourself into a warm shower to try and ease off that morning stiffness and morning pain. The symptoms often improve, obviously not just with exercise, but with certain types of medications we call non-steroidal anti-inflammatory drugs, or NSAIDs. That's over-the-counter anti-inflammatory drugs like ibuprofen, diclofenac, and naproxen. You may also have had a family history of people with immune complaints in the family. So they might have had ankylosing spondylitis, but they might have had psoriasis, lupus, rheumatoid arthritis. That just raises the chance that you also will be likely to suffer an autoimmune complaint. So are there any other things to think about? Well, it doesn't just come on all by itself. Sometimes it can be related to other conditions. For example, psoriasis, which is a skin condition that can give dry, scaly skin, can also cause joint inflammation and, indeed, inflammation in the spine. Another types of conditions that can cause inflammation in the spine are inflammatory bowel diseases. So ulcerative colitis and Crohn's disease can be related to spine inflammation. And for some people, they may get inflammation at the front of the eye, which we call iritis or uveitis. This gives a very painful red eye that you may end up having to go to hospital for because of the amount of pain that you get. What's the importance of picking this out? Well, if that pain of that kind of description has gone on for several weeks, you need to get it checked out by a healthcare practitioner. It's still quite sad to hear that despite knowing about this condition and having good technology to investigate it, it still takes most people years to get diagnosed with this condition. And why is that? Well, firstly, back pain that comes from inflammation is much less common than back pain that comes from mechanical causes. So frequently, when you're seeing a doctor, they're going to assume that, common things being common, this probably isn't back pain. And that can be especially so if you haven't seen the same doctor multiple times for those symptoms, or been clear with that doctor at the first meeting that, look, this isn't a one-off, I'm struggling with back pain that's been long-standing. The next thing is that it can be a little bit tricky to just easily diagnose this. There isn't a single blood test that's going to suddenly go, it's definitely inflammatory back pain. Markers of inflammation can be helpful. CRP, which is one marker of inflammation, or an ESR test, which can be helpful in inflammation, might go up. Unfortunately, those tests are not particularly sensitive in this type of condition. So they're good for some inflammatory problems, but for inflammatory back pain, it's quite common to get normal markers. An X-ray can be done to look at the pelvis. So we talked about the bottom of the pelvis where the spine joins the pelvis, called the sacroiliac joint. And that joint is one of the first ones to get inflamed. And if it becomes inflamed, that joint can fuse. But it takes years for that to take place. So if this has been going on for only 18 months, even though that's a long time to suffer from back pain, that X-ray might look normal. You might be having pain that's got a particular characteristic nature. Sacroiliac pain often goes into the buttock area, but unless the right types of tests are done, this might get missed. Now, one test you might hear about is an HLA-B27, and that test can be particularly helpful in increasing the likelihood that you'll be diagnosed with inflammatory back problems. But it's a genetic test, and in some parts of the country and in parts of the world, that proportion can be quite high. So in UK, amongst Caucasian individuals, 8% or so of people would have an HLA-B27 test. So just because you have the test being positive does not make you have the diagnosis, just that you're in much higher risk group. The best test is an MRI, but you have to have special kind of images taken. So sometimes when a GP is well-meaning and does an MRI, that specific sequence isn't done, or maybe the images are not read by someone who's trained to look for inflammatory back symptoms, and it might not get reported correctly. So the right thing to do if you have features of inflammatory back pain is actually just to go straight and see the rheumatologist, and they can arrange the tests rather than having to repeat tests that might not have been done correctly the first time. Finally, then, why is it important to have a review for inflammatory back pain? And the main reason is because we can do things about it. Anti-inflammatory drugs are certainly helpful. Education and understanding about inflammatory back pain is really important. And there are numerous charities out there which you can find links to on my website. But longer term, many patients with inflammatory back pain would benefit by being on targeted therapies. There are three main classes of drugs that work for inflammatory back pain. There are anti-TNF biologics, there are anti-IL-17 biologics, and there is the small molecule class known as JAK inhibitors. And these are generally well tolerated and generally very effective, but there are some considerations as to whether you will qualify for these drugs and which type of these drugs would be best for you. So if you're struggling, if you've had back pain that's been going on for multiple weeks, especially if it's causing you stiffness and pain first thing in the morning, don't delay. Go and see your GP, have a conversation about it. go and book with a rheumatologist if you can book directly. Get this investigated, and we can see if we can help you with some of these targeted therapies if, unfortunately, this does turn out to be an inflammatory back pain cause. I hope you found this useful. If you have any particular questions that I've not answered, or you'd like me to go into any more detail, anything covered in this video, do drop me something in the comments. Thank you.